Hi, this is Dr. Barron with High Point Spine and Joint Center. I wanted to take a quick second to make a short video recapping your diagnosis, as well as letting you know some of the treatment options we have to treat you in the office, and some things that you can do to help yourself with your condition as well. So you have what's called acute torticollis. Another term for that is wry neck, and it's characterized by muscle spasm or imbalance in your neck, which is usually one-sided. It can be bilateral, but it's usually on one side. And it's usually caused by a joint becoming super restricted or jammed together within the cervical spine or within your neck. Usually it's a cycle of pain, spasm that can be very severe, and it's characteristic that you'll have a little bit of a head tilt or a head rotation, where when you go to look at something, you can't turn your neck to do it, so you turn your whole body. And it's usually your body's way of moving away from inflammation in an attempt to decompress that joint that's really restricted. A lot of things can cause it. Sleeping in an awkward position is very common. People who sleep under a draft are more prone to this. Most patients will describe some sort of an unusual or a strenuous activity, oftentimes the day before. Sometimes it's a new exercise, or they've been traveling, or they slept in a new bed. But it can be as simple as just they rotated their head in a position, let's say to watch a movie or something like that, to one side, and they were in that position for a long time the day before. But there's lots of different things that can cause it, and sometimes it's kind of innocuous positions that can create this as well. So, like I said, it's characteristic to have this abnormal head tilt and not be able to turn your head very well because of the muscle pain and spasm. So some of the treatment options that we have to deal with this in the office, the number one thing we do is joint manipulation or adjusting, trying to get that restricted segment to move correctly. If we can get it to move, we can interrupt that pain cycle that's caused by the muscle spasm and inflammation. So we usually try to use joint manipulation or adjusting to help with that. Obviously, we have to adapt this sometimes based on how spasm and how painful the procedure is for you. Also, dry needling, using a monofilament needle into some of those spasm muscles can help to fire the muscle, get it to reset and relax. That can help with this pain cycle as well. We sometimes use electrotherapy modalities to help relax muscles, decrease pain, and then some certain therapeutic exercises and activities to help reestablish normal muscle firing and to help relax spasm muscles. Some things that you can do on your own. I think it's very important. Your sleep posture and position is very important with this. You want to avoid sleeping on your stomach. On your stomach, you always have to have your head turned one way or the other. That can lead to this. You might try to make sure you're not sleeping under a draft. Oftentimes, if you are sleeping by an open window or a cool breeze that's drafting in, and your body is warm underneath covers, and then you got a cool breeze or a cool draft blowing on your neck, that can cause this. So making sure that you don't have that temperature differential between your neck and the rest of your body, sometimes even sleeping with your neck covered in a scarf or a turtleneck, that can help a little bit. Obviously, the type of pillow you use is important, making sure that you have something that supports your head correctly and your neck correctly. Your workstation at work, making sure that things are in front of you. You're not always in prolonged postures where your head is turned or tilted. That will help as well. And being careful on your cell phone, being careful with texting and being in prolonged positions that way will help as well. So this is usually something that resolves very quickly. We see it a lot in the office, and so I'm sure that we can help you. If you have any questions, feel free to text our office, and we'll see you at your next appointment. Thank you.